This is the second session, Articulation and Acoustics, the second part. I am Mohsen Rezazadeh, lecturer at the University of Isfahan. Before starting this session, let's have an overview of what we said in the previous session. We talked about the airstream. We answered this question: what happens to airstream when we talk? We also mentioned voiced and voiceless sound. What is the difference between voiced and voiceless sounds, like in s and z? One of them is voice, one of them is voiceless. Next was the four main components of the speech mechanism. We also talked about sound waves and what we hear. We also introduced spectrogram in the previous session. Finally, we discussed different parts of the upper surface of the vocal tract and also parts of the lower surface of the vocal tract. Today we will talk about principal articulators of the vocal tract, and also we will talk about different places of articulation for consonants. Principal articulators of vocal tract. In order to form consonants, the airstream through the vocal tract must be obstructed in some way. Consonants can be classified according to the place and manner of this obstruction. The primary articulators that can cause an obstruction in most languages are the lips, the tongue, and the tip of the tongue and blade, in fact, and the back of the tongue. So we understand which articulator is making the gesture by the following terms. Speech gestures using the lips are called labial articulations. Those using the tip or blade of the tongue are called coronal articulations. And those using the back of the tongue are called dorsal articulations. If we do not need to specify the place of articulation in great detail, then the articulators for the consonants of English can be described using these terms. The word topic, for example, begins with a coronal consonant. In the middle is a labial consonant, and at the end a dorsal consonant. If you pay attention, you can understand that when you say a word like topic, t is made by the coronal part, that is, t is made by tip of the tongue or blade of the tongue. Topic, p is made by the lips, so it is a labial consonant. And at the end, topic, k is a dorsal one because it is made using the back of the tongue. In this slide, you can see a sagittal section of the vocal tract showing the places of articulation that occur in English. The coronal region is shown in more detail at the right, the second picture. We need to know more than which articulator is making the gesture, which is what the terms labial, coronal, and dorsal tell us. We need to know more than that. We also need to know what part of the upper vocal tract is involved. More specific places of articulation are indicated by the arrows going from one of the lower articulators to one of the upper articulators. As you can see in the picture, the arrows show that one of the lower articulators moves toward one of the upper articulators in order to produce consonants or sounds of any language. We need to be more specific. If you paid attention to the previous slide, we just talked about labial, coronal, and dorsal. But now we want to be more specific because there are so many possibilities in the coronal region. This area is shown in more detail at the right figure. In this picture, you can see different places of articulation in the vocal tract together with the sounds that they produce. As you can see, we produce B with the lips, or Fe with the lips and the teeth, or for example, The with tongue and the teeth, or Se with tongue and alveolar ridge, or She or Ye or Ke, for example, or even He. We use he with our throat. These are the major sounds or major consonants, at least in the English language. Now we will explain each of these sounds one by one, and we will name the place of articulation for each of these sounds. As you can see in this picture, the first part of the vocal tract that we use in order to make consonants are the lips. When we use our lips to make a sound, we call it bilabial because we use the two lips. For example, notice the first consonant in pie, by, my. Note how the lips come together for the first sound in each of these. P, b, m. As you can see, p, m, and b are all bilabials. We call them bilabials according to the place of articulation because they are made by both lips. Next place of articulation is called labiodental. Lower lip and upper front teeth are used here. Lower lip and upper front teeth. Most people, when saying words such as phi and vi, they raise the lower lip until it nearly touches the upper front teeth. Lower lip until it touches the upper front teeth. Now you can practice it yourself. Try to make a sound like f or v. As you see, you use the lower lip and the upper teeth. You contact the lower lip and the upper teeth in order to produce f or v, as in fight, as in virus. These are called labiodentals. Dental or interdental is the next place of articulation. As you can see in the figure, tongue tip or blade and upper front teeth are used. Tip of the tongue or blade of the tongue and upper front teeth. Say words like thigh or thy, thigh or thy. Some people, most speakers of American English as spoken in Midwest and on the West Coast, have the tip of the tongue between the upper and lower front teeth. Others, that is, most speakers of British English, have it close behind the upper front teeth. Both sounds are normal in English, and both may be called dental. If a distinction is needed, sounds in which the tongue protrudes between the teeth may be called interdental. So sounds that are produced between the teeth, these are called interdentals, and others are called dental. But we can interchangeably call them dental or interdental, as in thigh or thigh, tip or blade of the tongue, and upper front teeth. Alveolar. Alveolar is the next place of articulation we're going to talk about. As you can see in this picture, we use tongue tip or tongue blade and the alveolar ridge. Again, there are two possibilities in English, and you should find out which you use. You may pronounce words such as tie, die, nigh, sigh, zill, lie, these words, using the tip of the tongue or blade of the tongue. It depends on the person. Different people use different places. Some people use tip of the tongue when they want to say, for example, te, de. Some people use blade of the tongue, like te, de, de. It depends on you. You may use tip of the tongue for some of these words and blade of the tongue for other words. It depends on the person. The thing that you should know here is that sounds like te, de, ne, se, ze, la, these are the sounds that we call them alveolars, because we use tongue tip or blade plus the alveolar ridge in order to produce this sound, so we call them alveolars. For example, some people pronounce se with tip of the tongue tucked behind the lower teeth, and some people produce it with blade of the tongue, and in fact they touch the alveolar ridge with the blade of the tongue. You can try it right now. Try to use your tongue tip and the alveolar ridge like s, and blade of the tongue and alveolar ridge. S. Both of them have the same sound, and as I said, it depends on different people to use tip of the tongue or a blade of the tongue. Retroflex. Next place of articulation is called retroflex. As you can see in the picture, we use tongue tip and the back of the alveolar ridge. Tongue tip and back of the alveolar ridge. If you look at the arrows, you can see that we use back of the alveolar ridge. Retroflexes, in fact, have different places of articulation. Maybe right exactly the place when the alveolar ridge is finished, or maybe the beginning of the soft palate. It depends. We can say that it is about 1 centimeter. Maybe you touch the first, for example, millimeter, maybe you touch the middle, maybe you touch the ending part, but you use, for all of them, you use tongue tip and back of the alveolar ridge. For example, in words like rye, row, ray, when R is followed by a vowel, like in red or real. We show it by the symbol that you can see. It is something like an inverse R and a small W at the top. In fact, the distinctive feature of some retroflex consonants is that the tongue curls up slightly on itself when produced. Some speakers of Standard American English actually use a retroflex consonant. As I mentioned, it occurs in pretty much any word that starts with R followed by a vowel, as in red or real. These are retroflex sounds because the tongue curls up slightly on itself. We call it retroflex. In fact, maybe you've heard of Apu in Samsung. Some people call it Apu's D. You notice that his T and Ds are retroflex. Like some Indians, instead of T, they say D. Or instead of, for example, D, they say D. D. For example, instead of saying welcome to our house, they say welcome to our house. Or instead of door, they say door. Instead of de, they say de. In fact, the place of articulation for those people are different, and they, in fact, it curls up the tongue on the tongue itself in order to produce these sounds. But for us as Persian speakers of English, we can produce these sounds just like native speakers of English. Next place of articulation is post-alveolar or palatoalveolar. Post-alveolar or palatoalveolar. As you can see in the picture, tongue blade and back of the alveolar ridge is used. For example, shy, chill, chill, vision, Jill. These are all palatoalveolars. Tongue blade and back of the alveolar ridge is used. In the previous one, for Retroflex, we used tongue tip and back of the alveolar ridge, and the tongue was curled a little bit. But here, for post-alveolar, we use tongue blade and back of the alveolar ridge. For sounds like sh or ch, sh, ch, or j, like in j, like in Jill, Jill. As you can see in the picture, you can also try it yourself. Try to make a sound like ch, sh, and feel the place of articulation. You can feel that you use your tongue blade and back of the alveolar ridge, because these sounds are made farther back in the mouth than those in, for example, C or so. They can also be called post-alveolars. For example, se, we call it alveolar, but she, because it is made farther back in the mouth, we call it post-alveolar. In fact, you should be able to pronounce them with the tip or blade of your tongue. Again, it depends on you, but most people use the tongue blade and back of the alveolar ridge. From this place of articulation, which is called alveopalatal, it gets trickier because it's becoming more and more difficult to feel areas in your mouth that are that deep And also because for this specific place of articulation, alveopalatals are not present in standard American English, as far as I know. The best way to show you this point of articulation is to pronounce a sound like this. A similar sound in English is sh, but sh is, as I mentioned in the previous slide, is a palatoalveolar. Listen to this kind of sh that I produce right now. Sh, sh, and compare it with sh, 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 and compare it with shay, like sh, sh. This kind of shay or sh is present in Sweden, for example, for Swedish language. If you meet Swedish people, they pronounce sh like this, sh, sh. In fact, place of articulation is somehow further back when you compare it with palatoalveolars. This is called alveopalatal. Palatal, front of the tongue and heart palate. Say the word you very slowly so that you can isolate the consonant at the beginning. You, like this, you, y, y. This sound, y, is a palatal one. If you say this consonant by itself, y, you should be able to feel that it begins with the front of the tongue raised toward the heart palate. Y, y. Front of the tongue raises toward the heart palate. You can see the arrows, the red arrow in the picture. This is the exact location. Now try to hold the beginning consonant position and breathe in through the mouth. You will probably be able to feel the rush of cold air between the front of the tongue and the heart palate. Try to produce y, y, and now try to breathe in like this. Y. Then you can feel the rush of cold air between the front of the tongue and the heart palate. This is the exact location through which you produce sound like y, and we call this palatal. Next is velar, back of the tongue, and soft palate is used. The consonants that have the place of articulation farthest back in English are those that occur at the end of words like hack or hag or hang. K, g, and ng. These are all called velars. In all these sounds, the back of the tongue is raised so that it touches the velum. Look at the red arrow. This is the exact location that the back of the tongue is raised and touches this part, velum. So we call it velars. Sounds like k, k, g, g. Farther back in your mouth is uvula. Sometimes you use your uvula in order to produce some consonants. In fact, this sound or the sounds that are produced with uvula are not present in standard English, but we have them in Farsi. In Farsi, we produce a sound like r, R. If you produce this sound, you can feel the kind of vibration, a kind of vibration of your uvula. This is why we call it uvular. R is a uvular sound. A little deeper in your mouth, you can find the uvula. Uvula is the little thing that's dangling from the top in the back of the mouth, which is used for uvular consonants. As I said, there are none in standard American English, but imagine that the tongue has to reach an area a little deeper than, for example, in ng, or for example, in a word like king, king, g, a little back, even a little back than in k, in king, g is g. Try to pronounce them one after the other. G, 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 r, g, r, g, r, or g, g, r. So again, back of the tongue is used to reach that area. Also, in French language, we have r, r. In Farsi, we have r. French, they have r. For example, rouge, r, and r. Both of them are the same, but French r is a little bit different from r in Farsi, but both of them are uvulars. Glottal. This place of articulation is called glottal because we use our glottis in order to produce these sounds. The glottis is even deeper than the pharynx and epiglottis in the throat. You can see where glottal consonants are produced here. The glottis, as much as we might not realize, is used for the hair sound in English. If you look at the picture, you can see the red arrow. This is the place through which we produce a sound like in English. Just pronounce the words like happy, heat, happy, or heat. And notice how far down the throat these sounds come from. Other glottal sounds found in other languages also come from this location. Sounds like all of them are made with glottis and they're called glottal sounds. In this picture, you can see all places of articulation all together. They are shown with red arrows. You can see labiodentals, dentals, alveolars, retroflexes, palatoalveolars, palatals, velars, uvulars, and glottals. All of them are shown in one picture, and all of them are different places of articulation. As you can tell from the descriptions of these articulatory gestures, the first two, bilabial and labiodental, can be classified as labial, involving at least the lower lip. The next four, dental, alveolar, retroflex, and palatoalveolar or postalveolar. These are coronal articulations with the tip or blade of the tongue raised, and the last is velar. Velar is a dorsal articulation using the back of the tongue. Palatal sounds are sometimes classified as coronal articulations and sometimes as dorsal articulations, a point to which we shall return later. To get the feeling of different places of articulation, consider the consonant at the beginning of each of the following words. For example, fee, theme, see, she. Try to say these consonants by themselves. F, th, s, sh. Are they voiced or voiceless? Here, in the example I gave you, f, th, s, sh, all of them are voiceless. They also have a voiced counterpart. Like for f, we have v. Th is the voiced for th is th, or the voiced for example, sh is zh. All of them have a kind of voiced counterpart. But here in the example I gave you, f, th, s, sh, all of them are voiceless. But all in all, one way to categorize consonants is to categorize them based on different places of articulation. However, at most places of articulation, there are different ways of pronouncing them. These are called manners of articulation. Next part is about different manners of articulation. All in all, in this session, we talked about principal articulators of the vocal tract, which were labial, coronal, and dorsal. Then we talked about different places of articulation. We introduced bilabial, labiodental, dental, alveolar, retroflex, palatoalveolar, alveopalatal, and palatal. We also introduced other places of articulation like velar, uvular, and glottal. This is the end of the second session on places of articulation. Goodbye.